Cerebral palsy is a dysfunction of the brain which affects the movements and posture of a child as well as its mental development. The cause for cerebral palsy is damage in a child's brain before, during, or after birth. This can be due to lack of oxygen, due to infections, or lack of vitamins. Often the cause is unknown. Cerebral palsy is not curable, but you can improve your child's situation if you help it to move from early on and regularly in such a way that you can suppress its abnormal movements, and if you train your child's mental capacity and its capacity to communicate. Cerebral palsy can express itself differently in every disabled child. This depends on which part of the brain is damaged and how large the affected area is. The child may be deaf or blind. Its ability to move or its mental development may be affected, or all may appear together. Because of this, every child must be assessed individually. You have to keep in mind that the children can respond in very different ways to our treatment, and you have to observe their reactions very carefully in order to avoid causing them any damage. Movement disorders are easily seen immediately. Therefore, they often take up the parents' full attention, and then mental and sensory problems may be neglected or overlooked. Movement disorders are mainly: the child may be limp or stiff. It may have abnormal postures and patterns of movement, uncontrolled movements, lacking balance. All parents want their child to walk. This is, of course, normal. But often the effort to make it walk may cause major damage to the child, such as deformities of the bones or muscle contractures, which means that a muscle shortens and the child can no longer straighten it, even when the muscle is relaxed. So, never put a child on its feet before it is able to sit on its own in a stable, upright position, and it starts by itself to come up onto its feet, and not before the child can stand with its foot soles flat on the floor and can bear its body weight on its own. Always keep in mind, when your child grows up, it will need to be as independent as possible in its daily life. To achieve this goal, it has to practice first to communicate and to use its hands for eating, getting dressed, and for doing many small tasks in the house. A child's development is depending on the normal growth of the brain, and follows a standard development which cannot be changed or accelerated. This image shows how a healthy baby gradually develops more control over its body in the first 12 to 15 months and then is able to stand up. So, first the child is lying, then step by step it's able to sit, to crawl, to pull itself up, and finally to walk. One stage follows the other. Anyone who has seen a child grow up knows this. Despite this, we constantly try to go against this rule, for example, by putting children on their feet even before they can sit on their own. By doing this, we may cause serious damage to the child. Again, lying, sitting, crawling, getting up, and walking. In order to learn new body positions and skills, the child needs time to feel its body in the new position and to learn the movement pattern. And it needs many repetitions to feel secure in this movement. This is the same for all children. However, disabled children need even more time and practice. You only have to remember how you felt when you yourself learned to do something new, such as riding a bicycle. You were unsure, slow, maybe also afraid, and you had to practice many times before you felt safe and confident. This is also how a disabled child feels when it stretches to take an object, to sit, or to pull itself up in order to walk. You have to understand and remember, walking is not the most important skill for a child to learn first. There are other, more important goals, such as to talk, to communicate, to sit upright, to eat by itself, and to play. It would be better for these children if their parents would help them to eat by themselves, rather than feed them. This means that they can take care of themselves. To do something by itself will make the child proud, self-confident, and last but not least, happy. Remember that your disabled child will grow up to be an adult, so you have to make sure that it is as independent of others in daily life as possible. Everything starts with the right posture. In this position, the child is not able to establish contact with others, to focus its eyes on faces or objects in front of it, or to grasp these objects. To improve the posture of the child, put it onto its back, and while doing this, talk to it in order to calm it down and to get its attention. In order to bend the child's body slightly forwards, put a folded cloth or a small pillow under its head. Take care that your child is lying with its body in a symmetrical posture, that the arms are slightly bent and the legs are apart. Through light pressure onto the chest, you can stimulate the child to bend its body forwards. Check to see if its muscles are relaxed and if the child is comfortable. If the arms and hands are tight, you can try through outwards rotation of the arm and then of the hand to loosen the muscle tension. Now the child is ready to receive sensory input. Try to get the child's attention by talking to it, to cause eye movements with an object, and to stimulate the child to open its hands, even if, as in this case, the child is not yet able to do it. You can take both the child's hands and move them together rhythmically. You can also bring its hands towards its face, and while doing all this, you should talk or sing to the child. When the child learns to take hold of things, offer it objects of varying shapes, surface, size, and weight, so that it receives different kinds of sensory impressions. Turn the child to the left and right, or forwards and backwards. All movements are done very slowly and repeated again and again, so that the child has opportunity to experience how normal body positions feel, that is, to have sensomotoric experiences. Turn your child onto its stomach and take care, while doing this, that its body is still slightly bent forwards, and put it onto a folded cloth. Take the shoulders and arms to the front. Through light pressure onto the lower back, stimulate the child to lift its head. When the child learns to use its hands, it can begin to play independently in this position. When your child has developed up to the stage that it is able to hold its head, put it on your lap with its legs apart and support its back so it is sitting straight upright, with the hips and joints of the legs bent and the weight bared equally on both sides of the body. Never keep your child for hours in the same position, as this may cause muscle contractures. Change its position often, at least when you see the child is getting tired. Lay it down. When lifting the child, first turn it onto its side holding it at the shoulders, and then slowly pull it up. Never pull it straight up holding its hands, as long as the child is not yet able to keep its head up and to sit straight upright. Otherwise, it will be too difficult for the child. For carrying, you can use different positions, but it is important that the legs are always apart. Never hold and carry a child like this. Again, always keep the child upright with its legs apart. Also, when the child is being fed, a good posture is important, so that the child is as relaxed as possible and can swallow normally without choking. The mother should not hold it at the back of its head, but should put her arm around the shoulders of the child, so that both its head as well as its shoulders are supported. This boy does not have enough balance to keep his body stable and upright, so he is not yet ready to walk. He first needs to have stability in his trunk and the ability to bear his body weight on his own. In addition, he unfortunately already has muscle contractures, which are causing his hip and leg joints to be abnormally bent. This boy is getting the proper support from his father, who is holding him at his hips. The brain of a disabled child is damaged, so a cure is not possible. But improvement is possible if your child can get regular therapy by a physiotherapist at least once a week. But the main person is the mother and father. This 1 hour of therapy a week cannot do much for your child if you don't also handle it in a good way for daily activities and play at home. You are the most important person for the proper development of your child and for preventing muscle contractures and bone deformities. Therefore, let us review again the most important points. The needs of the child are to have contact with others, to touch, to talk, to smile, to sing, and so on. Caring and attentive parents, but at the same time enough opportunity for the child to develop on its own all its hidden abilities, movements, mental and social skills. To be as independent in daily life activities as possible, such as during eating, getting dressed, moving from one place to another, which will all help the child to feel proud, self-confident, and happy. Remember that your child will grow up to be an adult who needs all these skills. Also, prevention of muscle contractures and bone deformities. So that your child can still manage well enough in daily life, such as eating on its own and performing general tasks when it gets older, especially the movements of the hands have to be practiced, as well as the mental capacity to use the hands in the most efficient and practical way. So you must also train your child's mental skills and continue to always talk to it and explain things, even if it seems that it cannot understand much of what you say. Only this way it will also learn to speak itself. Be patient and observe carefully and closely when your child's development is very slow or abnormal. Don't force it. Don't discourage your child by demanding skills it is not yet able to do. Praise it for every new skill it learns to do. At the same time, don't limit your child's activities. Disabled children are often able to do much more by themselves than we would expect of them, even if they are still slow and not yet perfect. Anything your child does by itself will make it feel proud of itself, self-confident, and happy. This video is showing the existing situation at a charitable health center in a very underdeveloped and neglected region of northeastern India, and the efforts to treat and help the many disabled children there. It also reflects the lack of financial resources and of highly skilled staff, with the resulting limitations in diagnostic and therapeutic methods. The video was made out of the wish to convey from the perspective of a pediatrician the knowledge of the normal development of a child and of its disturbance by cerebral palsy. It aims to sharpen the perception of the parents and staff of the capabilities and needs of a disabled child, of pathological movement patterns, and of the risks of abnormal development. This video does not deal with the therapy of cerebral palsy, but rather reflects the existing situation and the observed habits in dealing with disabled children at the health center. In view of the complexity of the subject matter and of the limitations regarding time, technical means, and instructive visual material while making the video, it is far from being perfect or complete. However, it can and should give suggestions about how one can deal with disabled children in day-to-day life, so that their development is improved and additional damage can be prevented, and last but not least, so that the children feel comfortable and safe. The basis for this, apart from the conveyed knowledge, is also the ability to see and respect the child as an individual person from a holistic perspective, physically, mentally, and socially. Questions, comments, and suggestions are welcome and can be emailed to renateschüssler@gmx.net, dsa1234@gmail.com. Any financial or other support for the health center is always extremely appreciated and will help us to maintain and expand our services for the disabled children and the surrounding communities. To learn more about supporting our projects or to make a donation, please visit www.rural-health-india.org.